Hi everyone, this is Ramya from Techedumaster near MIC Medical College, Kolancherry. So today I'm here to provide some information regarding the use of abbreviations. Many of the students have some confusion regarding which all abbreviations can be used and which all has to be avoided. So I hope this video will be helping you regarding the use of abbreviations in OET letter. So you know that there are a number of abbreviations in medical world which can make life more easier, but when you are writing an OET letter, it is really important to make it appropriate. You have to use it appropriate. The abbreviations should be appropriate, or you have some confusion whether you have to elaborate everything. Yeah, let's have a look on that one. So when to avoid these abbreviations? Although the rule for abbreviations are changing over time, sometimes it's better to write the word as such. So I would like to give you some guidelines regarding the use of abbreviations. The first one is that you need to think whether the recipients can understand the abbreviations which we are using, whether the recipient can understand it or not. To be frank, there isn't a list of acceptable abbreviations and symbols which OET assessors will be accepting. In fact, the acceptable abbreviations will be understood by the recipients. Okay, so for example, it's like commonly used abbreviations like BP, BMI, CT, X-ray. These kind of abbreviations is understood by people. So you can use these type of abbreviations. And again, I would like to tell you that don't use abbreviations that your colleague won't be able to understand. For example, as a nurse, if you're writing a letter to a family, to a family member, don't ever try to use this type of abbreviations. Okay, the second guidelines which I would like to give you is that, can I use abbreviations for medical condition? That is also a quite important question, whether you can use abbreviations when you are writing medical condition. I should say that no. Why? Because you know, when we are writing about a medical condition, write the full form of this condition. Example, when you are writing about postnatal depression, it's always better to write like postnatal depression rather than PND. Okay, you know why? Because the other person can understand it clearly. Okay, by that what you are meaning. Another thing is that it doesn't mean that you need to always elaborate. If you want to repeat the condition again and again on your letter, that doesn't mean that everywhere you need to go for writing this one. It's like when you're writing for the first time, you can just put a bracket and you can put the elaborated, it's abbreviation in that bracket, and later you can go for using the abbreviated forms. Okay, otherwise it's always better to go for writing the elaborated form as such. Next, the third guidelines which I would like to share you is that sometimes the same abbreviation will be having multiple meanings, multiple elaborated forms will be there. So in such situation, it's always better to go for writing the elaborated form itself. For example, when it comes to AD, it can be Alzheimer's disease or acute distress. Another thing is that when you're writing about PD, it can be Parkinson diseases or personality disorder. So there are such situations that you will be coming across when you are dealing with this medical profession. I hope you understand that. So again, another thing is that another point which you have to take care is that never and ever use abbreviations when you're writing about diabetics. If it is a non-insulin dependent diabetic mellitus, you have to go for writing the elaborated form rather than NIDDM. Okay. Now the last guideline which I would like to tell you is that most of the students have confusion, like I have seen many students writing like BID 2/7, these kind of things. But to be frank, I have to tell you that when you are writing about drug administrations, it's always better to go for writing the elaborated form. Never and ever use the symbols and abbreviations for these things in an OET letter. Okay, like if the patient needs to, like I'll just give you some examples like BID, you know that is twice daily, go for writing that one. And again, another thing, 2/7, twice weekly, and PRN as required. So you need to, you can, if you come to my Telegram group, you will be finding these kind of abbreviations, the elaborated form of these abbreviations you can find over there, or else they can say that on my Facebook page also. So you have to understand these type of abbreviations, and you need to go for writing the elaborated form as such there. Okay, another thing is that many of the students will be having confusion like what are the acceptable abbreviations that can be used. Simply I have to say that use your common sense and try to understand whether the opposite person, the recipient, can understand it or not. Okay, another thing what you have to take care when you are writing the medication list is that when you are writing about the units of measurements like milligram, you don't want to go for writing the elaborated form, you can go for writing mg. Okay, so I hope these are the guidelines which I had, which I would like to discuss with you. Now I would like to give some basic rule of the use of abbreviations in OET letter. The first one is that think about the recipient. That is very important. You have to think about the recipient and use the abbreviations accordingly. Second one is that any abbreviations or symbol regarding drug administration could be elaborated. Okay, or sometimes it can be confusing, that's why I'm telling it should be elaborated. Third one is that being aware, you have to be aware that there are differences between the abbreviations used in Australia, Canada, the UK, the USA. So writing in full will be good and it is acceptable. The last rule which I need to tell you is that make sure that the abbreviations are up to date, that they are currently in use. Okay, so these are the informations which I would like to share with you. So I hope this video is clear and it is useful. Thank you so much.